So I'm Julie MacDonald. I'm local to the area. I live in Penshaw, and I used to be a Deputy Director of Nursing at Sunderland South Tyneside Hospitals, but I retired a couple of years ago. It was in May 2017 I found a breast lump, and then I was referred to the Queen Elizabeth Hospital, a one-stop shop. I had a scan, I had a biopsy, I had a mammogram, and by the time I left there, they said it was highly probable I had breast cancer, but they had to wait for the results of the biopsy. Well, I think the word cancer just is terrifying to anybody. And, I just thought I was going to die. I wasn't really sure what the odds were, what my prognosis was going to be. But they gave me lots of written information, and I went home and I read all this information. From then I generated a list of questions, and I knew what I wanted to ask, and I had to go back to clinic. I think it was about a week later, and they had the biopsy results, and they confirmed that it was a cancer and said it would have to be removed. I straight away said I wanted a mastectomy. And actually the surgeon said the prognosis wouldn't be any better whether it was a mastectomy or a lumpectomy. And in fact, it might delay my treatment because the scar would be bigger to heal, so it might take longer to start the next phase of treatment. So I opted for a lumpectomy. What I hadn't quite appreciated was after you've had your surgery, they have to wait and examine the tumour, and there was 2 lumps, which they'd managed to remove successfully, and it hadn't spread anywhere else. But the bad news was the type of cancer it was would need chemotherapy, radiotherapy, and a whole host of other things, and my treatment could go on for 5 to 10 years to stop it coming back. I think the chemotherapy started once the scar had healed, so maybe about 6 weeks later. But I was really, really worried about chemotherapy because you just hear bad things about it and how ill people feel, and so I was worried about that. Mine was an infusion, so basically a drip in my arm that took about an hour and a half to 2 hours, and a nurse was with us the whole time that I was having that. The first 4 or 5 days I would feel really tired, quite feeling sickly, a bit bloated, indigestion. The nurses in the Phoenix unit explained to us it affects your blood count, your white cell count, so you become very susceptible to infection. While I was feeling well, it meant I still wouldn't want to go out shopping or, to the pub or anything. And then the last week, started feeling almost back to normal, and would start socialising again and, going out for a meal and things like that. I certainly wasn't the person I was when I wasn't having chemo, but, I was able to do things and socialise with my family. So I had the radiotherapy at the Freeman Hospital, and you lie under the machine for 2 or 3 minutes and then it's done. But before you have the radiotherapy, they put some little tattoos on your chest so they know exactly where to put them. I hadn't expected that, and I've still got them. They're my war wounds. They did offer to have them removed, but they're just tiny little dots, you can't see them. And the side effects of the radiotherapy were prickly heat, a rash like prickly heat, nothing major, and they gave us cream for that. And I had to have that every day, I think it was, for 3 weeks. And I had that after the chemotherapy had finished. I mean, everyone was fabulous. I haven't got anything bad to say about any of my experience. But there were some key individuals that stuck out. There was the breast care specialist nurse who was based at the QE, who supported us during surgery. But that first appointment in clinic, she gave us the booklet. She gave me her phone number, a direct line, and I could ring her any time with questions, and I did. I rang her lots and lots of times. And then there was the nurses in the Phoenix unit who, I think when you're going so regularly, you get to know them, and I think they try to give you the same nurse whenever they can, and that really helped. So they would also know what to ask you. You said you were feeling a bit more sickly last time. Has that settled? When I said, well, no, the nausea was worse this time, they said, okay, before you leave today, we'll speak to the pharmacist or the consultant and we'll put you on stronger medication. They also gave us a phone number for the Phoenix unit 24 hours a day. When I was thinking about chemotherapy, my biggest anxiety was losing my hair. And so I explored getting a cold cap, and I decided it wasn't the right thing for me. But the breast cancer specialist nurse told us that I was entitled to a voucher on the NHS. And I found out about a charity called My New Hair, and I contacted a salon which was on the website in Bolton, Tribeca Salon, and they were amazing. And the wig I got was exactly the same as my own hairstyle. And even my own mother couldn't recognise that I had a wig on. She said, "Oh, have you been to the hairdressers?" You know, it was such a good wig. And that was such a reassurance for us. At the minute, I'm having 6 monthly infusions, which is, again, just to stop it coming back. But it means I'm still under the care of the Phoenix unit, and I get my bloods done and I get checked. The infusions that I have every 6 months, I don't even think about them, and I don't get any side effects from them. But I find it quite reassuring that I still see the staff in the Phoenix unit. And the other treatment that I need to take for 10 years is a tablet, which will be managed by my GP. And I can ring the breast care specialist nurse anytime I want. And in fact, I had another breast lump last year. And I rang the breast care specialist nurse. She arranged to see me in clinic. She arranged for it to be scanned. And it turned out it was just scar tissue. But it's really reassuring to know that you can go straight to the specialist and you don't have to wait and go through your GP again. I think the big thing that sticks out for me was when I was given a cancer diagnosis, I automatically thought it meant I was going to die. And it doesn't. It absolutely doesn't. And you know, you need to have those conversations with your specialist nurses and your consultants and make use of those phone numbers. You know, if you come out of clinic and think, I don't even know what they meant then, ring them up and ask them. It does make you more anxious about your health, but I just get on with it. And, you know, life's a living. I've now retired and spend my life going on holiday and loving every minute.